Sorry for running over.
Thank you, Richie. Excellent presentation, and obviously it's always good when we start discussion. So I'm going to present our next presenter, Amanda Hogan. Yes, got it. So she is the program director for the sonography programs at Bellin College. She's a board member for the Midwest Society of Ultrasound Professionals, writes test questions for the ARDMS board exams, continuing education questions for JDMS, and is a peer reviewer for both the JDMS and American Institute of Ultrasound and Medicine. Amanda holds a master's and a bachelor's degree from the University of Colorado Global Campus, majoring in healthcare administration. She has a doctoral degree in business with an emphasis in healthcare administration from California University, and she will be talking about curriculum maps and applying to clinical and competencies. So welcome, Amanda.
Beautiful. Thank you. Push this back. Hello, everybody. So I'm curious, how many are new programs or kind of in that accreditation cycle where maybe you're going up for accreditation soon? Perfect. We have some seasoned programs here who have gone through accreditation. So I've gone through a lot of accreditation. We just did re-accreditation for abdomen, OB, vascular. We did adult echo probably 3 years ago, and then we did peds echo this past fall. So Jerry and I are good friends. I email him a lot. So, no, I'm good. So I've really worked with curriculum maps a lot. We use them a lot in our programs anytime we have a change. So hopefully some insight on how to properly fill these out will help you with your accreditation processes. So just some disclosures, I am no way involved with CAAHEP or JRC DMS, so I'm not a board member for them. I don't do site reviews. This is personally just how I have experienced site visits and the feedback that I have gotten from site visitors on being organized and being easy to read. All right, so I'm sure all of you in here are very familiar with standards. So if you go to the JRC DMS website, this is your golden link. This is what you want to save on every computer, every desktop, print it out. I have a highlighted one everywhere in my office. So you should know this document like the back of your hand. And then we have these curriculum maps. I'm not quite sure when they started, but we did not have curriculum maps when I first got it accredited, and that was 8 years ago. So they're newer, but it's a wonderful resource, and it's under Appendix B. So all the curriculum maps are found under Appendix B, and they're specific for each specialty that you have. So there's cardiac, there's abdomen, there's OB, but also very important that you don't miss it, there's also a general one that everybody is responsible for. I like to think of the standards kind of as the overarching umbrella over everything. So the standards really, truly should guide everything that you do in your programs. So you are held accountable for these. It's wonderful if you go above and beyond them, but making sure at bare minimum you are meeting these standards in everything that you're doing will make sure that you have a great accreditation visit. So when it comes to course design and course outcomes, I like to borrow a lot of the objectives that we find on the standards. I think it's just really smart. Why reinvent when you can just borrow the standards, borrow the objectives? And I think the course design, course outcomes, those are the easier components to really prove. Like you can prove that you're teaching ergonomics in your course. That's pretty simple. But when it comes to evaluations and clinical competencies, there's not really a standard. There's no standard template that we have to follow. There's not even really a number of competencies that you have to find. So that's really the more difficult part that I want to focus on today is how can you make sure your competencies, your clinical evaluations, how do you make sure those meet the standards? And the proof for all this, once you do all the hard work, is just filling out that curriculum map. So again, 2 standards to be aware of, and I can honestly say that I missed the general standard. I want to say it was if, I submitted my self-study and I'm getting ready for everything, and I'm like, oh, there's a standard, there's a curriculum map for just general ultrasound that everybody, no matter your specialty, has to fill out. So make sure that you don't miss that. This is your fair warning. You're gonna fill out 2 no matter what program that you're in. Here's just an example of just the general one. So learning competencies common to all concentrations. So there's things like ergonomics, the role of the sonographer in preventing MSIs, industry standards, OSHA guidelines. So how do you take these and how do you really apply them to your classes? Here's what I like to do. So the top is an example of my syllabus. So in my syllabus, I like to borrow the objectives that we have in all of our standards. So much so that on the bottom here is our curriculum map and our common core standards. Above that is going to be my own personal unit objectives. I have that one, I have that one, I have those ones, I have that one. I have everything, right? That's how I prove it. I put it in there, and then there's no doubt that in that PowerPoint, I am absolutely teaching everything that's in that standard. So I like to print things because I'm a little bit old school. I print those standards, and every single line on the standard, I am writing what class, what unit, where is that baby, because I need to make sure that I can prove that I'm teaching it. Then I go a step further. So I have 3 requirements for my faculty for PowerPoints. The first one is you have to have a title slide. The second one is you have to have your content outline. And then the third one is your unit objectives, which again are a lot of the standards that are going to be on those JRC DMS standards. So I have them in multiple places. And so my faculty have autonomy. They can use any PowerPoint they want, but they have to have these 3 slides. And I would think, I'm not a site reviewer, but I would think as a site reviewer who's going to look to make sure that I teach these things, that they're gonna look at my PowerPoint and they're gonna be like, oh, okay, and number 3, prevention, wow, they have the industry standards, OSHA. They can do a Control F and literally find that slide that I talk about OSHA and the industry standards. So I would think as a site reviewer, that would be very easy to prove that I am in compliance with that standard then. So here's your curriculum map and kind of where I would fill this out then. So our proofs in our curriculum map, the JRC DMS changed this maybe a year and a half ago, and they're Excels now, which I'm super excited about. They used to be a Word document, and now they're in Excel. And what's great about that is we can hyperlink things. So you can see all the standards. You want to fill in the course number and title, which you can see I did there. I do it in my introduction class. Course semester and term, spring year 1. The method. The more specific that you can get, I feel like the easier it will be for a reviewer. So the reviewers are looking for content. They're making sure that we're meeting those standards. That's why they're visiting us. So the easier you can make it on the reviewers, the better. You'll have a shorter site visit. You can have more time to talk and make friends. And then the location and title of the file. This is where I highly recommend to hyperlink it. And so I'm gonna kind of show you, I hyperlinked this one. So it's the role of the sonographer in the prevention of musculoskeletal injuries. I do an ergonomics lab activity. Just so everyone's aware, if you don't work with Excel a lot, I might do 3 things to teach this standard, but you can only hyperlink 1. So hyperlink a good one. You can only hyperlink 1. So I highlight it, I hyperlink it, and it's gonna bring it right to my learning management system. So they can literally click on it. They'll have access to my learning management system when they're either virtual or on campus, and they can literally click on all the activities then. So they can scroll down, here's those learning outcomes repeated again for this unit, and they can see my assessment. So they can see I have an ergonomics article review. There's no question. I absolutely met that standard. All right, back to this. You can also link a document. So you don't have to link your learning management system if you don't have one. You can embed PowerPoints in here if you needed to. You can embed a Word document, which is what this is. So this is just an ergonomic protocol that I'm showing that students know that they have to do this when they go to lab. They practice it. They make sure they're good at ergonomics. All right, so the theory components, in my mind, I feel like the theory is the most straightforward portion. So we just have to make sure that the JRC DMS standards are taught. Make sure you borrow the outcomes. Why not? They're there for a reason. We're not stealing them. We can borrow them and make sure we're teaching them at that level. I think the best practice is including them in your course objectives and or unit objectives. Include the objectives on PowerPoints. It's very specific then. You can't miss them. You know you're required to teach that for the PowerPoint. So have a slide minimum with everything listed on it, and then we put it on our curriculum maps. So back to the overview. Really, I think the left-hand side is easy. You can look at the standards, you can copy them into your courses, you can make sure you have slides on them and teach them. It's really the clinical competencies and evaluations that can be kind of tricky. All right, so the word demonstrate. Everyone's gonna interpret this a little bit differently. And I think that's one of the hardest parts you'll see in a slide coming up. People who were surveyed through the JRC DMS on LinkedIn, I saw it, what's the hardest part about accreditation? Interpreting the standards, because we all interpret it differently. To me, demonstration means physically doing in the clinical setting. And I would think a lot of you in here would argue the same thing. So how do you prove that? Put it on your clinical competency form. When I first started the program more than 10 years ago, I literally had every one of these listed on my clinical competency, and my competencies were 2 pages long. And then we got feedback from our CIs, like, no one wants to fill out a 2-page competency. It's just not realistic. So we did minimize it. We included evaluations to try to get to some of these. So here's an example of 2 different competencies that we have. Generally, they're 1 page. The highlighted areas on both, though, are verbatim from the clinical standards. So a site reviewer could come into our campus and they could look at our evaluation and be like, well, are you really evaluating if your students can apply appropriate measurement techniques? Yep, check the box. It's there, it's on that. Every clinical competency that we have meets that standard. They're for sure getting tested on that. Competency list. So what competencies should you do? You can combine competencies. We tend to just go ahead and do exactly what the JRC DMS does. So on the right-hand side, number 4, those are the standards. That's what the JRC DMS tells us that we have to at least prove competency in. And on our left-hand side, that's my required competency list. So it is essentially exactly the same. I call them the same thing. They've changed names a little bit, but I always go back to what does the JRC DMS call it? And whenever they call it, I'm going to call it that. So for example, in laboratory, we used to call them comp outs instead of proficiencies. I just changed the verbiage. So I changed the verbiage back to proficiency, so it is as clear as it can possibly be that everything I do is exactly the same way that JRC DMS describes it or does it or explains it. So here's another example. This is the adult cardiac curriculum map. And as you can see, we are talking about the different competencies and what is listed underneath that. So I have every single clinical course because students can complete competencies in all 5 of our clinical courses, the semesters that they are, and then the different clinical competencies that we have. So without a doubt, because I have that verbiage in every single competency or in some of them that it makes sense, I'm going to meet those standards. There's no question about it. Evaluations. So because we had to not have 2-page competency forms, we also send evaluations to our preceptors. And that's where some of this stuff that doesn't necessarily, it could be included in a competency, but maybe not the best spot for it, it landed here. So things that are highlighted, so just demonstrates professional behavior. I copy and paste this from the standards. I don't create it. I might use artificial intelligence, which we'll talk about tomorrow. But I make sure that word for word I have it on my evaluation. And so everything highlighted here is the exact phrase used on the evaluations as what you see in the standards. So we send this out twice a semester. We get them back from our CIs or different staff at our sites and get feedback and make sure that, again, we're meeting all these standards. Maintaining safety of infection control principles. That doesn't always make sense to be in every single competency. I feel like sometimes our sites just say, yep, they met those expectations all the way down, when I want real feedback on this, and I feel like I get better feedback on those types of questions on an evaluation rather than a competency form. So some other things that we have to demonstrate for all learning concentration. So make sure you don't miss this, because this is separate from the vascular competencies. It's separate from the adult echo competencies. This applies to all specialties. So it's a really easy one to miss because you don't think that there's a general competency, but there is. So make sure that these are included on any specialty that you have. So things like proper ergonomics, safety and infection control, history, communications, ALARA, professionalism, etc. And these can be combined, so you can combine these into multiple competencies or evaluation, so however you assess your students. All right, so difficult standards to prove. So competencies completed in clinical, proficiencies can be completed in lab. So there's this little extra area that we can simulate. So on G, demonstrate proficiency in technique and application of stress, basically, or TE. So the proficiencies may be demonstrated in a clinical setting or in a simulated environment. I like black and white, but this is a lot of gray, right? So do you do it in clinical? Do you do it in lab? I truly don't think it matters as long as it's done and you can prove that you tested your students and that they demonstrated. So it's not knowledge. It's not necessarily a test question. You have to show that they can actually demonstrate that. And how I interpret that standard is physically doing. When somebody demonstrates something, I see that as physically doing something. So how do we do stress? We've done it a few different ways where we had nurses come in and do a lecture. We've gone to our stress labs. And then we really tried to think outside the box and how can we make this fun for students so that they can actually learn, because they're not getting a ton of experience scanning right away. It's high stakes, right? You only have a short window. And so what we did is we teamed up with our physical therapy department. And we asked, are there any volunteers who want to run on a treadmill for us? And we want to scan them right after. And of course, the physical therapy students are like, yeah, I totally want to get involved with this. So we do a whole day out of it. So we have different stations. We have about 10 PT students that help us out. We'll do an EKG, and then we kind of rotate. We'll do a pre-scan. We'll do it after, obviously. So these are our students, and this is one of our PT students running on the treadmill. And so for me, this really demonstrates, it's a simulated environment, it's not in clinical, but it really demonstrates that they are able to take the knowledge that they have, apply it, and acquire those images rapid succession, just like they're going to have to do in a clinical setting. And we found that the more that we do things like this, the better prepared for our clinical sites our students really are. And so they've done really well in the stress lab then because they've had this type of experience. And we do repeat this every semester so that they keep getting better and better and better at it. So here is a LinkedIn questionnaire that the JRC did, and I just found this. I thought it was great. So the most challenging aspect of accreditation. So apprehension, it is super nerve-wracking. So for those of you who've never gone through it before, who are just starting to, approach it in a way where they're there to help you. They're not there to pick out all the bad things that you do. They're literally there to make sure that you're teaching the students at such a high level, at such a high standard, and they're there to help you. And if you approach it that way, it's not quite as bad as you think it's going to be. Completing the self-study, interpreting the standards, that is a really hard part. It's difficult to interpret the standards, but thankfully we're in a room where a lot of us are educators, almost all of us, and we can help you, and we can help think outside the box on how we can really demonstrate these standards. So some takeaways. Make sure each line is in your didactic lab or clinical course. So each objective that's on that curriculum map, each standard, make sure that that is going to be in your course. Anytime I think about changing a course, anytime I think about changing anything, I'm always like, did you check the curriculum map? So my faculty fill these out, and I fill them out for the courses that I teach. And you cannot change something if it infects the curriculum map. And if it does, we have to make sure that that is included somewhere else. I be as specific as possible. I copy and paste. I'm not gonna reinvent the wheel. There's no need to. Work smarter, not harder is my life motto. They made great objectives. Why not use them? So then there's no question. Is what you're saying as an objective what JRC DMS standard objective is? I don't know. But if you use the same one, there's absolutely no question. It is exactly as it says it is. And on the curriculum map, links. Use hyperlinks. It's just that much easier, I would assume, as a site visitor, to just go to that curriculum map, click on your hyperlink, and it's either going to take you to the PowerPoint, to the Word document, to your LMS system, there's absolutely no question then. It's right there, and you can easily prove that you are meeting that standard. Again, the fun fact, each cell only can have one hyperlink. So if you prove that standard multiple different ways, pick the best one, because you can only hyperlink one time in an Excel cell. What questions do you have? Yeah.
So when you do your stress test, do they sign a waiver, like a release or something?
They do when they first enter the program for PT. So we have a consent form, and it's all encompassing. So when they start the program at our college, everybody signs the waiver.
But do you have guests that come and do the stress?
No guest, but if they did, they would also sign the waiver. Great question. Yes.
This is probably for everybody in the room. God, I don't need this. How do you determine what a competency is for an ECHO student? This is like pretend I know nothing. How do you define that? So how do you have your preceptors sign off on that?
Sure. So I just want to make sure I understand your question correctly. What is my definition of a competency?
Yep.
Perfect. So my definition of a competency and our definition is that they can fully scan whatever part, whatever view, whatever the competency is by themselves with little to no help, and be able to answer the questions if anybody has them. So if it's a certain pathology, it's coronary artery disease, they have to be able to answer all the questions and be 100% competent in that comp to perform it.
All right, so what would a question be in CAD? This is actually scanning a patient?
Yes, correct.
Okay,
So
can
a
you give me
proficiency on our end, we use the same verbiage as JRC DMS. A proficiency can be done in lab. A competency has to be done in the clinical setting, not simulated on a real patient.
Okay, so I just want to figure this out. Do you use trajectories?
We just started.
Okay.
So they start in fall. I haven't used it yet.
Okay, so yeah, our preceptors use trajectories.
Sure.
So we don't call them competencies.
Sure.
But the general program does.
Sure.
Like they do X amount of abdomens. I don't know exactly. I don't call them that. And the other thing is, you had like cardiomyopathy up there. You can have HOCM. You know, you could have a veg. Not all of them see the same thing. So
Sure.
like one of my labs is one of the top HOCM clinics, all right, in the country. So whoever goes there sees a gazillion HOCMs.
Sure.
Right? So how do you deal with that part?
All of our students rotate.
Okay.
It's not in writing as a standard as far as I'm aware, but I think that it's highly encouraged for students to have different experiences with outpatient, inpatient. It's not a standard though, right, Jerry? So we do rotate our students. They actually rotate 5 different times minimum just to see different things for that sole reason.
Okay, so that's something, where's Richie? Right there, like, my sites will not rotate them.
Sure,
Like, maybe 10% of them were.
sure,
They have the attitude of, if I'm taking them,
sure,
because I want to hire them, and I'm keeping them.
sure.
So how do you deal with that? And I know we're a little bit off the cuff, but, or anybody.
I'm curious, is like the site tells you that, how long are they there for?
Mine, there's 2 different programs. One's a solid year, and then the other one is 2 semesters. Depends if it's the advanced program or not.
So at the end of the day, like the site needs to trust that you're the educational institute and you're determining the objectives that are met for the accreditation bodies and for the student's experience. Like they're not, you know what I'm saying? Like,
Yeah, but you can't tell Mass General that. You can't tell the Brigham that.
Could
will
you
lose
do,
them. You will lose them.
We've had that where we rotate our students, so they only go to clinical 3 days a week, and they go for 2 years. And so what we do is we'll say, oh yes, we can keep this student there. They're there on Monday and Tuesdays, that's their clinical rotation, but on Wednesdays, they're going somewhere else.
Okay.
So we do try that just so we have an extra day. Even if it's not full-time, at least they're going to get to a site that does things a different way. And I do present it in my advisory committee that it is a benefit. Either way, I see both sides. You're really learning someone's way of doing things if you don't rotate, but you're also getting 5 different job interviews and 5 different ways of doing things if you rotate your clinical site. So I see benefits to both sides. Our PAC committee really just suggested that we do rotate. So I guess I don't have the same issue, but I can see that that would be one. Yeah.
So, your question, have you conferred with the program director in the general program I'm sorry. Have you conferred with your program director in your general program about your dilemma and see if
Trying to place people in general and echo, we're not sure why, completely different animals. It's the hardest part of my job has been in clinical sites. Relative to the way they get it, it's unbelievably different. And I don't know why. None of us know why,
Sure.
unfortunately.
I was just curious, like a show of hands, how many people have tried these curriculum maps so far? And were they super easy for you? Okay. Well, I was Amanda's site visitor, and you know, I truly believe in fate. I think that you can meet a person for the very first time and they impact your life, right? And that's the person that I got the privilege of meeting, because curriculum maps were very, very new. And here I'm going to site visit her, and she had a baby that was like 2 minutes old. And she came to her site visit, and look how she has detailed that throughout her entire program. So see how one drop of water, I met this person, and when Cresta came to me and asked, could you be a part of the steering committee, I said, I'd like to get Amanda Hogan, and I would love her to talk about curriculum maps. So one little baby meeting, and look at how many you've impacted today. So she's fabulous, and thank you for coming.
I love answering questions. So if you guys get home and you're like, oh, how did Amanda do this? Or what's a great idea? My email is at the end here. Here's some standards, some references. This is my contact by all means. At least once a week, I call other program directors. Like, we're all a team. We're here to educate the best stenographers that we possibly can, and I'm here to help you. I'm not an expert, but I feel like I've been through a lot of accreditation that I kind of understand the process.
So Amanda, thank you so much for touting the JRC TMS in this meeting. I really appreciate your insight, and thank you for sharing that with everybody. Just to also expand on the curriculum maps, as those programs that are accredited through JRC DMS, we do have now an accreditation portal in which programs are doing their annual reports as well too, but we've now expanded it where we're actually having programs being able to do their self-study on the portal. So that's on that curriculum map as well too. I know that Joy has some experience with that, correct, with regards to the self-study. So she has some experience, and I'm sure that it's been a lot easier doing it on the portal as opposed to a Word document, correct?
Well, yeah, when I first started, it was on the Word document. I'd just seen it before I did her site visit, and so I was struggling with it. And here she's on Mount Everest eating cookies. And I haven't even got my boots on yet. And she was, well, yes, you map it here, you hyperlink, and you squeeze, you tweet, you twerk, and you do everything else. And, you know, and so now I just felt like it was okay. You know, like the way that it makes total sense when you hear it from her. Is that true? Total sense. Just put it here, 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 and here. Have all your faculty follow it, and that it seemed very clear. But I was just so impressed by the fact that her kid was, I haven't gone back from my maternity leave, but I'm coming for my site visit, and she laid all this out so perfectly. And it's something that needs to be shared with all of you. And
There's definitely, it's an easy process if you work the tools that JRC gives you, for sure.
I just want to say, I think the curriculum maps are brilliant.
Agreed.
Because it's a foundation for all programs, whatever modality or teaching that you have. Because then if you decide to go leave tomorrow, somebody can come in right behind you and they know how your program runs, but it is a foundation. And I think how they created it at JRC is great, because now we all know what we're teaching
Correct.
across the country, and it's
if you remember the master plan, has anyone did those before? So it's essentially a really improved version of the master plan that we used to have to do. Yes. Beautiful. Well, feel free to email me, call me anytime. I'm always happy